Hello and good evening. I'm Melisa Idris.
And I'm Sharaad Kuttan.
You're watching Consider This, the show where we want you to consider and then reconsider what you know of the news of the day. World Health Day is celebrated every year on April 7th. It's a day of global awareness in building a fairer, healthier world. And in this past year, more than a year has passed now since the world began its battle against COVID-19. And throughout the past year, we've had to rely a lot on journalism to make sense of it all, especially as the virus's spread frequently outpaced our own abilities to comprehend and respond to the pandemic. So our guests tonight on the show, we have Azrul Khalib. He is the Chief Executive of the Galen Center for Health and Social Policy, which is an independent policy research and advocacy organization. We also have Su-Lyn, who is the Editor-in-Chief of Code Blue, which is a health news portal. Code Blue is a program under the Galen Center. So it's a pleasure to have you both. Thank you so much for being on the show. If I may begin with Azrul, to help us understand, Azrul, why Galen Center decided to set up Code Blue. What was, I guess, why the need to set up a new media portal or new news portal as opposed to an existing media organization? Did you see a gap that needed to be filled?
Well, for one thing, Malaysia's health ecosystem today rivals that of more developed countries and is no longer what it was, 2 decades ago or even 5 years ago even. And the needs are great. And one of the things that we need to be able to talk about, especially when it comes to these issues, is that it needs to be able to be populated by a diversity of opinion, vibrant discussions, and most importantly, debate on the issues and policies that are being put forward by policymakers, especially those of the government.
Okay.
We can't be in a situation where we're passive recipients of whatever policies that are being issued out by the different public or private entities. So in Malaysia, when we had a discussion about what kind of vacuum there was, the information vacuum is quite stark, where it is very much a situation of a top-down approach where people are expected to take in whatever has been already decided by the government, for example, the Ministry of Health, and to be able to accept it as gospel. And we lack the kind of discourse that you see in the UK, in the US, even Indonesia, where the discussion is a lot more vibrant on health, simply because they don't take health for granted.
Yeah, I want to, Su-Lyn, we could jump in here. You're a journalist of many years. In fact, we once worked together many years ago. So I wonder, for you as a journalist, setting up a portal, but under an organization that has very strong positions in terms of advocacy, of policy and principles. Was that a difficult mix? Because journalists often don't work under specific advocacy parameters.
Yeah, that's a good question. When Azrul and I, decided to set up Code Blue in 2019, so it was a very conscious decision that we made, looking at the dearth of news outfits or any media organizations looking specifically at healthcare issues, right? And because we wanted more critical thinking, and the countries that Azrul cited, these are countries where a lot of times healthcare is a political issue, it's an election issue. But in Malaysia, because healthcare is supposedly RM1, it's not RM1. Like healthcare isn't that cheap here. It's subsidized. It's subsidized greatly, but someone is paying for it. Taxpayers are paying for it. So if taxpayers are paying for it, then we should be able to demand for better healthcare and not just simply accept whatever we get. We shouldn't just be happy with whatever health services we get or the quality of it. We should be able to demand for more because taxpayers are paying for these health services. So when we set up Code Blue, I wanted to provide a platform for people to talk about these issues. And it does tie in with advocacy because I do think so, though, Sharaad, that the idea of journalism as being above it all or as being neutral per se, I don't think that works now. I don't think that works anymore. I mean, you see it here in Malaysia, you see it in the US or in the UK. A lot of different media outlets have their own bias and they're quite explicit about it. And it doesn't matter which is the government of the day. Like if it's the New York Times, they are a liberal newspaper and they're not going to change. It doesn't matter who is in power. In Malaysia, well, we've only had one change of government, and we saw how media organizations changed after that. So when it comes to Code Blue, we advocate for healthcare. We are quite unapologetic about that because our tagline is health is a human right. But we are independent in the sense that we hold the government of the day, no matter who is the government, to account for all the health policies.
And you said that it was started up in 2019. So just before the pandemic hit, can you give us a sense of how much Code Blue has grown from the time that you set up in 2019 and this past year, which I think a lot of us, myself included, has gone to Code Blue to kind of help make sense of what's happening. I mean,
I'd add to say that it was a lucky break. I mean, so many names have been now. I mean, we think of Ed Yong from The Atlantic, the Malaysian-born journalist, who's made a huge reputation from this pandemic. I mean, we don't want to be visited by more pandemics.
There was an opportunity in the crisis, and one that if I may, Code Blue seized and did well in. So maybe you can tell us a bit about how much Code Blue has grown in the past year.
Well, we started from nothing. It was just me alone for quite a long time. For several months in 2019, it was really just me writing the stories, doing the interviews, getting the pictures and putting it up. And then when we would get like a few dozen views a day, I would jump up and down and join, oh, someone's actually reading us. and it's health, it's health.
It's dedicated
to
health.
Dedicated to health. But we were quite fortunate because we did have a few veteran physicians who believed in Code Blue right from the start. And I know at the beginning that some people were quite dismissive of Code Blue and they were saying, oh, it's just a health blog. And it's quite funny because now those very same people who were dismissing us, now they ask us, can you please publish our op-eds?
Okay. But it's not just publishing the daily press conference, MOH press conference numbers, right? The daily caseloads. It's more than that. So maybe you can talk about the editorial direction of it.
Right. So Code Blue, because we are such a small team. I mean, we started up as a startup, and we are still a startup. We don't have tons of investments coming in to build a huge team. So there's just me as the editor. We have 2 health writers and 1 sub-editor. So there's just the 4 of us. So yes, we focus exclusively on healthcare issues and policies, not just in Malaysia, but also around the world. I mean, we keep track of what's happening around the world related to COVID, especially since that's what everyone's talking about now. Because we focus on health, we didn't want to replicate the coverage in other mainstream sites. So like I said, when Code Blue was set up, there was, of course, some health coverage in other newspapers, in other media outlets, but they weren't very focused or very comprehensive. So I was very determined to make Code Blue a source of not just the latest healthcare issues and policies, but also to explain to people complicated health issues in a way that they understand. So, we explain jargon and we explain what is it we explain what really is happening. So when there are press conferences or when there are press reports, for example, the daily COVID press reports and the daily cases and all that, I don't see it valuable to replicate that on the site because people can just easily go directly to the Health Director General's website, right? But we tell you what the statistics mean, what isn't being explicitly said by the government, and we tell you what is it that's behind those numbers.
Right. Azrul, what about Galen Center? Give us a sense, because in some ways your flagship portal is now maybe raced ahead in terms of visibility and reputation than your center itself. I mean, help us understand where Galen Center is coming from and how that feed back into sort of editorial thinking at Code Blue.
Well, for one thing, they're editorially independent.
Okay.
So, I also get complaints. I send my complaints to them too. Like I would put out press release and they don't even cover it.
We do. If it's newsworthy, we cover it.
Or even to get comments. I would get calls from other media asking for my comments on a particular issue. They never do. So there is a distinct separation between the Galen Center and Code Blue. If it is that Code Blue is growing in leaps and bounds in terms of reputation and also branding and presence, we're happy that that is happening, because the function of Code Blue, of Galen Center is very much one that is working behind the scenes and one that is working on advocacy at the policy level, engagement with different stakeholders, and working with patients and individuals in the health sector to make a change and difference through what is very often closed-door meetings
Right.
and
But
discussions
because
and
of
so
that
forth.
engagement, Azrul, does it make it difficult, particularly when Code Blue publishes an expose or an op-ed piece that condemns the current pandemic management? And I'm sure Galen Center, with all your advocacy work and engagement, needs to have a good relationship with the medical fraternity, particularly those in government. How does that jive?
Well, definitely, for one thing, I don't think Code Blue is going to be condemning anyone anytime soon when it comes to the management of the epidemic. But when it does come to the issue of being critical, we're very much supportive of whatever angle that's going for, especially if you remember the hospital Sultanah Aminah case, where you had the fires in Johor, and that there was a certain direction there that needed a certain expose, as it were. And we're happy that that's happening. We do feel a little bit of the heat simply because we are, as for all intents and purposes, the publisher of Code Blue, and therefore needing to explain, what is our relationship, but also what kind of degree of separation that we have, so that we can do the work that we need to do, and to engage the necessary people, because it does become a problem, though. I will not discount that. It does create some potential problem, but that happened at the beginning. But today we're at a place where people see very clearly the separation that we have.
There's been enough time.
And there's a lot of respect.
Okay, but I do want to just, if we could squeeze in this last comment, which is there something generative and productive about the relationship between Code Blue and Galen Center? Because Galen Center is an advocacy group, and it clearly will have positions. And I remember this emerging in our discussions about a mix of public and private sector involvement in any kind of campaign, including the one over the pandemic. And that's about political values too. So, Su-Lyn, what are the kind of productive relationships, conversations do you have with Galen Center?
Well, I think we play quite complementary roles. So I see the Galen as playing more of a behind-the-scenes advocacy, because sometimes you do need that. You don't have to be so public all the time, but a lot of times also, sometimes you do need to be public about it. You can't just work behind the scenes and hope that you get the policies that you want if you're not courageous enough, or if you don't dare to publicly voice your dissatisfaction with whatever issues, right? So when it comes to those issues, so there are some groups, there are different groups across the board that will come to the Galen Center with issues, and then Azrul and I will discuss those issues.
Do you ever disagree?
Oh, yeah.
On issues
On
on
certain issues.
Okay, right.
Yeah, so he tells me what's going on, and then for Code Blue, then I see if it's worth something that's worth following up on. So if people want to go public with those issues that you're facing, then we can go ahead and write up what it is that they want. If they don't want to, if they still want to work behind the scenes, that's fine too. But at least now the option is there. People know that they have a platform from which to speak out about different health issues that affect them.
Okay, all right, we're going to take a quick break, but we will be back with more, continuing this conversation with the Galen Center and Code Blue in just a couple minutes. Stay tuned to Consider This. Welcome back to Consider This. I'm Melisa Idris. With me is Sharaad Kuttan. We're speaking tonight to Su-Lyn, the editor of Code Blue, as well as Azrul Khalib, Chief Executive Officer of Galen Center. Let's talk a little bit about this past year and what you've seen come out of public health policy, particularly in dealing with the pandemic and with the vaccine rollout. What have been some of the more interesting debates that you've observed over the past year? And what has that told you about not just the Malaysian public, but the thinking that goes behind creating public policy in health? Azrul, may I start with you?
Well, one of the things that emerged early on was what was the seriousness of this epidemic. And even though we've seen very much the responses of other countries, Malaysia has had the benefit of a robust healthcare system that has gone through several different epidemics. When you think about MERS, SARS, H1N1, H5N1, and we've been able to, well, I wouldn't say surf through, but we did well. So this was the first time really that the whole of society was practically involved, that drastic measures needed to be imposed, and these lockdown measures were having to be put into place. And you could see that society themselves had to be persuaded into thinking this was something serious.
Okay.
And that there were debates, even to the point of today, where you think about where we were and where we are today, that it took us a while to get to the point where we treat it seriously, that we would actually change our behavior, lifestyle, you know, wear masks, wash hands often. And now when we talk about vaccines, which is the latest point of contention, is whether or not the vaccines work, which vaccines work, and whether or not they're even required for us, you know. So there's a lot of debate that has happened in the health sphere that's as a result of the COVID crisis. And we're glad that both the Galen Center and Code Blue are part of this emerging space that, you know, despite having so much complacency in the health sector for so long, now it's being taken more seriously. There's more
I
discussion
like that
about
you said,
public health.
you know, we've taken health for granted.
We have.
Okay, but I want to ask you this. I mean, there've been a lot of advocates and there are a lot of discussions that are about principles, right? All of society approach and all these things get enunciated. But time and time again, we're also up against a doublespeak or contradictory messaging coming from government and so on, especially from government. And we can take, for example, the whole issue about undocumented workers. I mean, that's a classic example of confusion in messaging and in practice, right? So, Su-Lyn, from your point of view, how do we untangle that? I mean, how do you get past the nice taglines that are often produced and then the reality, which is somewhat, you know, in contradiction with that?
I think, Sharaad, the government has to acknowledge that it can't manage COVID on its own. We tried to do that when COVID first hit us early last year, and it seemed to work because the first movement control order was 7 weeks long, and reported cases really went down after that. And that was really the government's own doing, right? But also you have to give credit to Malaysians themselves for very, very high public compliance. We just obeyed. The government locked us down, put us at home, they didn't let us go out more than 10 km, and we complied. We willingly did it. There was no problem. You know, you don't see the same problems that you see in other Western countries. But then after that, because COVID is such a dangerous pathogen, I think Malaysia underestimated it, the government underestimated it, and the virus came back. And because of that, now we are in a place where, although cases are decreasing, but again, it's a perception. I mean, reported figures are only that, they are reported. So public health experts have already said that we are actually in a mitigation phase, which means that, so mitigation phase is one part of the epidemic, which is after containment. So containment means the outbreak or outbreaks are small enough to contain with lockdown measures. But if the virus is too widespread and it's everywhere in the community, then you can't use lockdown measures to contain it anymore because it's already widespread. So that's when you mitigate. Mitigate means you want to prevent, instead of trying to reduce daily infections, you want to prevent severe disease and death. And to do that, the government has to acknowledge that it has to work together with everyone. I mean, a lot of private health practitioners have been saying this right from the start. You can't do it alone. I mean, you may want to take credit for it, but the reality is that this virus is just too big, this epidemic is too big for anyone to handle alone.
Is it particularly also because Malaysia has a dual healthcare system?
I mean, that's part of it, but well, public health has always been the domain of the state anyway.
Okay.
You know.
I wanted to ask both of you this question. Maybe you can take turns in answering. But whether you think your work in this past year, and I know both of you have been working very hard in this past year, whether your work in advocacy and your work in journalism, whether you've seen that start to change things on the outside, influence policy making, decision making, conversations by the media, by the public. Are you seeing any kind of ripple effect, Azrul?
Well, we definitely saw an improvement in the quality of debate in Parliament when it was allowed to be convened, where the budget was being debated upon. And you saw health emerging quite strongly as compared to previous debates where health was barely mentioned. Of course, it's not just because of COVID. The issues that were being raised was concerning cancer, was concerning chronic kidney disease, non-communicable diseases, but also the long-term effects of these diseases on people, issues of malnutrition, stunting. So a lot of the focus today has been on, yes, COVID, but also everything else under health, which is a good improvement. And definitely, if we're talking about politicizing health in a good way, as what was mentioned by Su-Lyn, I can tell you, Mel, that we should and would be able to benefit from a discussion where people feel that they have a stake in the quality of healthcare that they're receiving, and not just being passive recipients who would then say, bersyukurlah that we've received this from the government, and instead talk about what do we need for an aging society, what do we need for the future for healthcare, what kind of medicines, what kind of treatment that's going to be available for us if we fall sick. These discussions are necessary.
I want to just add to Melissa's question, and for you, Su-Lyn, to respond to it, in that, in the issue of whether health journalism as a whole is also transforming. And over the last year, there's been a lot of discussion about how much journalists have to know about epidemiology and epidemiological principles in order to report accurately.
Right.
And and the fixation with listicles or numbers and these charts that are constantly produced, right? What about you? What your personal challenge to deal with something as complex as an epidemic and the medical science behind it? What has that been your struggle, and how do you see it with the rest of the fraternity, as it were?
That's a good question. So COVID is complexing even to scientists, right? What more to journalists who don't have a background in medicine. One of my writers does have a background in medicine, so that helps with certain jargon. But COVID, obviously, it's a new disease, and we had to learn by talking to just as many people as possible. And because we're so focused on health, we know the difference between a GP and an epidemiologist and a public health specialist. Whereas for mainstream media, if they see doctor, they think doctor knows everything. That's not true. So when you talk to a lot of people, and of course, because it's science and people have differing opinions, like one example is, are we testing enough? Some experts that I spoke to said we are not. Others said we are, and there's no point testing more because tests are really expensive and they only capture that moment in time as to whether you have the disease or not, right? So there are a lot of differing opinions. So Code Blue, we don't have a stand, obviously, and we publish whatever it is that experts say. And because when you talk to a lot of people, and obviously we read a lot of international news reports as well, the BBC Stat, the US Stat News, New York Times, they have really good reports on COVID and on medical issues. And then when you read a lot and then you learn, and then when you talk to a lot of people, and then it's, you can just ask these scientists questions, like if you know them, you've been talking to them for a while, you can ask, what does this mean, and they'll tell you.
Right.
And that's when you pick up the knowledge, and with that knowledge, then you can also, I think more importantly, you can challenge what it is that the government is telling you.
Right.
Because you have the knowledge yourself. And you don't just swallow hook, line and sinker what the government is telling you, and you can interpret the data. So like Sharaad, when you ask how is it like in the mainstream media, I have to say this honestly, I think their knowledge is really, really basic when it comes to COVID, even a year into the epidemic. And I don't really blame them or their newsrooms per se. I think it's because it's quite rare for mainstream media organizations to have just one dedicated person reporting on COVID. I think a lot of newsrooms, they just swap people, and when that happens, and because they're also not just reporting on COVID, but on political issues, so you don't really have one person specifically tasked to report on COVID. So then, because of that, most people don't end up brushing up their knowledge about it.
Well, in the couple of minutes that we have left, I want to ask you both. I mean, both of you work within this field and talk a lot about COVID. How has the new amendment to the emergency ordinance on fake news impacted your work? Because it specifically says fake news about COVID-19. Does that make your work more difficult? Do you think about what you're saying more now because of this, Su-Lyn?
Yeah, well, Code Blue, we're definitely more careful with what we report. In a sense, we don't censor ourselves, but if it is something that I think could be controversial, then I make sure that we get comments from the other side first before publishing. And ever since the vaccine rollout, I've noticed that a lot of hospitals, public hospitals, mostly MOH, they have become more open about giving comments immediately, so that helps.
Okay, that's
Yeah.
good. Azrul, does that
Well,
make
we've
you-
always been able to maintain a robustness in doing the due diligence for information that's being made public. So when it did come out, we were concerned that the interpretation is being done by somebody who may decide
Correct, yes.
that this is fake or not fake. And we've seen several instances in the past where something that was not fake was deemed as fake. You know, maybe it was premature to release that information.
Correct.
And so
The
forth, it was
information
labeled,
could
yeah.
change, right? Yeah.
So our concern really is that science is evolving. It evolves. Science concerning COVID-19 changes practically every other day. So what could be considered false previously could be truth today. And one issue is concerning whether or not pregnant women could be vaccinated. Earlier it was recommended against, and it was actually labeled as fake, that you could be vaccinated. And then later on, the recommendation was that women who are pregnant can be vaccinated. So in science, we need to not have these kinds of censorship or sanctions that limit the robust discussions and the debates that must be cultivated in order for us to have a much more thorough understanding of the science, especially when it comes to outbreaks like COVID-19.
Thank you both for being on the show, particularly in helping us mark World Health Day today. We appreciate your time. Keep up the good work.
Thanks,
Thank you.
Melissa. Sharaad.
Thank you, Sharaad. Thank you, Melissa.
That's all we have for you on this episode of Consider This. But before we leave you tonight, a quick reminder to get all your COVID-19 vaccine news and information on the Astro AWANI app as well as astroawani.com. I'm Melisa Idris.
And I'm Sharaad Kuttan, signing off for the evening.
Thank you so much for watching. Good night.
Good night.